Hello guys, welcome to my YouTube channel. This is the best YouTube channel where you get to learn medicine and the comfort of your home. If this is the very first time that you are coming across this video or you are coming across this channel, kindly consider subscribing. You hit the notification bell. You can also comment, like and share. If you have any question, you can also post it in the comment section. I will go through it and I will answer you accordingly. You can also welcome as many other people as possible so that they can get to know about this channel, so that I can be able to reach a wide range of people. So as usual, I normally do videos and I normally upload videos most on most common conditions and as per the request of my esteemed viewers. And in that reason, today I will be doing a video about a very common condition that is affecting the females of reproductive age, and not any other topic but this topic about the ovarian cyst. So as usual, I will try to explain to you what we mean by ovarian cyst. I will explain to you about the types of ovarian cysts that are very common. I will talk about the signs and symptoms that anytime when you experience any of these symptoms, you are supposed to go into the hospital and get checked of whether you have this ovarian cyst. I will talk of the complications, and also I will talk about the people who are most likely to suffer from this ovarian cyst, and automatically I will talk about the diagnosis, and finally I will talk about the treatments that are there for ovarian cyst. So you are welcome. Now, what we basically mean by ovarian cyst, or in other words, the cyst of the ovaries. The cyst of the ovaries, these are the sacs. They are usually kind of sacs that are filled by either by a fluid or a semi-solid thing. And what we mean by this is this being the ovaries in every woman, because every lady must have the ovaries. So what we mean by ovarian cyst, what we take it as a collection of fluid or semi-solid substances that are either inside the ovary or outside the ovary. So that is basically what we mean by ovarian cyst. So anytime you are told of an ovarian cyst, don't think it's a very big thing. What we basically mean, it's whereby your ovaries, the two of them all, maybe even one of your ovary, it's much more filled by a fluid or any semi-solid substance in it. So that one is the simple definition of ovarian cyst. Now, when we talk of ovarian cyst, we have various types of ovarian cyst, but the ovarian cysts that are mostly common among women. And now I will try to talk about the types of ovarian cysts that are there, and the types that most of the time they keep on affecting our females. So we have two types. We have more than two types, but in a bigger percent, I will try to talk about one type of ovarian cyst. And number one, we have the cyst that we classify under something that we refer to as the simple cyst. We have the simple or the functional cyst. Okay, so we have this one, and under the simple we have number one. Under the simple, we have what we refer to as the follicular cyst, and we have what we refer to as the corpus luteum cyst. So these are the type of cyst that are in simple. Then we have another type of cyst that we refer to as the dermoid cyst or the teratoma. We can also refer to them as teratoma. We have a third type of cyst that we refer to as cystadenoma. We also have another one, endometrioma. This one is also a type of a these are also type of cyst. But now, in all these types of cyst, we have the most common type of cyst. The most common type of cyst that we have are this one, the simple cyst. Now, I will try to explain what are the follicular cysts are, and I will also explain what are the corpus luteum cyst. Now, what we mean by follicular cyst, these follicular cysts, they occur as a result of ovulation. Now, when we talk of ovulation, what we simply mean by ovulation, this is the release of a mature egg from the ovary into the fallopian tubes awaiting for fertilization. That is what we mean by ovulation. Now, in this case, during ovulation, or what happens for ovulation to occur, in an ovary here, we have follicles that are inside. Now, the purpose of these follicles, these are the things that releases an egg out. Or, in other words, these follicles now, this one being a follicle, we term this one as a follicle. It bursts. It has first it burst. After now it bursts, then it releases an egg outside. Now, that is the normal way how these follicles are supposed to work. Now, what happens now for this follicular cyst to occur? What happens? These cysts or these follicles, they fail to break, or in other words, they fail to burst. And when they fail to burst, the follicle inside there, or the egg inside there, continues to swell and continues to be bigger, ending up into becoming a follicular cyst. So that's how follicular cyst happens. Now, when we talk of a corpus luteum cyst, after now this follicle has ruptured, it produces the corpus luteum. Okay, so this corpus, it's supposed to rupture so that it can release the corpus luteum. After now it ruptures, it's not supposed to cover itself, or it's not supposed to block itself. After it ruptures, it is supposed to remain that way and continue to shrink. Now, what happens for this corpus luteum to happen? After now it has burstened, then it closes again. When it closes again, there is a accumulation of fluid inside there that ends up to become a corpus luteum, because naturally it does not supposed to close. It's supposed to remain open and continue to dissolve. But if it fails now, if it closes, if it happens these closes, then there will be a collection of fluids inside there, which can be either a semisolid thing, it can either be a fluid, it can be pus, it can even be blood, which ends up becoming a corpus luteum cyst. So anytime when you have this kind of a follicular cyst, what it simply means, it means that your ovaries are functioning normally, or they are functioning the way they are supposed to function. Okay, now these are the most common type of ovarian cysts that are there, although we have these other, and I will in a hurry talk about this other. What we mean by the dermoid cyst, these are the kind of cysts that contains any other tissue of the body. In this cyst, you might maybe have some hair follicles, you might have hair follicles in it, you might even have nails, you might have cells of the brain, you might even have a teeth in it. So these are the kind of cysts that we refer to as the dermoid cyst, or the teratomas. So we have another one that we refer to as the cystadenoma. So in this cystadenoma, this is whereby accumulation of fluid forms outside it comes and forms outside the ovary. Now that one is what we mean by cystadenoma. Then we have endometrioma. Endometrioma cysts, these are the cysts that forms. We remember in a topic where we talked about the pelvic inflammatory disease, and we also talked about endometriosis, I explained what we mean by endometrium. So endometrium being the inner lining of the uterus, okay? Now, what happens in this case, the tissue that are lining the endometrium ends up moving out, and they attach themselves into the ovaries, then causing to endometrioma cyst. So those are the common types of ovarian cyst, okay? Now, this being the common types of ovarian cyst, I would like us now again to talk about who are the people who are at a higher risk of developing these ovarian cyst. Even before we proceed, I would like you to remember, as I talked about this ovarian cyst, I have said that these ovarian cyst in most cases are controlled by hormones, because every time you ovulate, the ovulation is also controlled by hormones, and in most cases these ovarian cysts are also controlled by hormones. Now, I want us to talk about the risk factors, or who are the people who are at a higher risk of getting this ovarian cyst. So number one, it depends with the age. What we mean by age, these are the people who are at a reproductive health stage, okay? So these are the people who have not got into menopause because they are keeping on ovulation. So another group of people that are at a higher risk of getting this, it's the people who are pregnant. So this is as a history of mostly developing when you are pregnant because of the estrogen, progesterone, hormone, and all that balancing, okay? Now, another class of people who are at a higher risk of developing these are the people, maybe if you have an history of previous, if you have a history of previous ovarian cyst. If you have any other history of ovarian cyst, you are also most likely again to suffer from this ovarian cyst. Another people who are at a higher risk of developing ovarian cyst, if it happens, because we have talked about the age, we have talked about the pregnancy, we have talked about the history of previous history, the another group of people are the people who have any other underlying condition, and these conditions are most probably the hormonal condition. So in these cases, if you have a disease that we refer to as PCOS, I talked about this. If you have endometriosis, I also talked about this, okay? So if you have any of these conditions, you are most likely to develop ovarian cyst, okay? And also, if you have another condition that I also talked about, the pelvic inflammatory disease, or the PID, you are also most likely to suffer from this ovarian cyst. Now, I have already talked about the people who are at a higher risk of developing this ovarian cyst. I have talked about the types that are mostly there in ovarian cyst, and now I want us to talk about the signs and the symptoms of ovarian cyst, or what are the signs that maybe if you experience, you need to get worried of, maybe you might be suffering from ovarian cyst. And after I talk about the signs and symptoms of ovarian cyst, I will proceed and talk about the complications. I will talk about the diagnosis technique, or what can you do if maybe after this you learn and you realize maybe you have any of these symptoms. Now, what are you supposed to do in order to confirm or to fully diagnose that you are suffering from these ovarian cyst? So the signs and symptoms of ovarian cyst, the signs and symptoms of ovarian cyst that basically we have number one, we have back pains. And this is back pain that maybe starts from the back, and then it's all, in other words, it migrates, or it radiates to the lower thighs, okay? Or it radiates to the thighs, okay? So that one is one sign and symptoms of ovarian cyst. So if in case you have any pain that is beginning from the back, and then it it migrates down to the thighs. That one is one sign of ovarian cyst. Another signs of ovarian cyst, it's whereby you experience pain during intercourse. Is when you experience pain during sex. So if it happens you experience pain during sex or even after sex, that one is also another sign of ovarian cyst. Another sign of ovarian cyst, it's whereby you have pain, you experience pain during bowel movement. Okay, so what we mean by experiencing pain during movement, and this is especially when you are on your menses. Okay, especially when you are on your menses. So if it happens you experience a pain during bowel movement, what we mean by bowel movement is this is when you are defecating or maybe when you are pooping. So, and especially during your menses you start experiencing that discomfort and pain. That one is also a sign of ovarian cyst. Another sign of ovarian cyst, it's where you have abdominal fullness, or in other ones we can refer it to as bloating. So when you feel your abdomen is somehow full, you are feeling a feeling of bloating, that one is also another very common sign of ovarian cyst. This ovarian cyst, when it develops to higher to grow into a bigger cyst, it can result with the flank pains. What we mean by flank pains is just below your ribs. Below your ribs, you start experiencing a lot of pain. That one is also another sign of ovarian cyst. So this ovarian cyst, if it persists, it can also cause dizziness or the feeling of fainting. So this one is also another sign of ovarian cyst that in most cases you are likely to experience. Okay, so these are mostly these are the most common signs and the symptoms of ovarian cyst. But I would like to say that in most cases ovarian cyst does not have any signs. At first you might fail to maybe think of you are suffering from ovarian cyst. So these are now the most common signs and symptoms that you are likely to experience when you have ovarian cyst. Okay, now let's now talk about how you can diagnose this ovarian cyst. Or number one, what can you do to diagnose? Then diagnosis number one that we depend on ultrasound as usual. Remember I said most of the gynecological cases, one of the basic diagnosis technique that we can use is ultrasound. Okay, we also have things like the CT scan, we also have the MRI. Okay, and in this case because when we'll get to talk about the complication of ovarian cyst, I will talk about the cancer, okay, as one of the complication of ovarian cyst. That is, if it's left untreated, or if it turns from being a benign tumor to malignant tumor. So for this reason, in most cases, there is a test that we do, the CA 125. Okay, so we basically do this kind of a test to rule out maybe whether you might be having some cancer cells in you. So now these are the diagnostic techniques that are there, and these are the diagnostic techniques that we can commonly have. But if it happens anytime we present with the signs and symptoms that I've talked about them before, the basic diagnostic technique that we'll go through and that we'll take into consideration first is the ultrasound. Okay, now I've talked about that one. Now let me talk about the complications. Well, what is the worst sign of ovarian cyst? So this ovarian cyst, number one, it can lead to something that we refer to as the ovarian torsion. So what we mean by ovarian torsion, this is whereby the ovary moves from its original place and it can twist. So when this ovarian torsion twists, it blocks the blood supply. It cuts off the blood supply. When there is an ovarian twist, then there will be a blockage of blood supply, and there will be also lack of oxygen, which may lead to death of the ovaries after this ovarian torsion have taken place. Another kind of complication is whereby we have ovarian rupture. So ovarian rupture, it's also another complication that can occur. So if it happens, this ovarian rupture occurs, there might be some bleeding. Okay, so if there is bleeding after now this ovarian rupture and there is bleeding, then we term this one as a hemorrhagic. We term to this as hemorrhagic ovarian cyst because it's bleeding. So hemorrhagic, that one is just we mean by bleeding. So if it happens, there is this ovarian rupture and it ends up bleeding, then we end up saying that you have an hemorrhagic ovarian cyst. Another complication, we also have another complication whereby you can have an ovarian cancer. Okay, so if this one goes to some extent, it can lead to ovarian cancer. So these are the most of the complications that are there in ovarian cyst, but in most cases they are somehow rare to occur. But there are some cases of ovarian torsion. When there are these cases of ovarian torsion and there is cut off of oxygen supply and the blood supply, people present with severe pain on their flank pain. So they present with a lot of pain on the flank signs. They also present with feeling of burning. Okay, so if there is this ovarian rupture, automatically there will be some internal bleeding in the peritonitis, or into the peritoneum, which can also lead to some other infections of the peritoneum cavity that we refer to as the peritonitis. Okay, so those are some of the complications that are there, but in very rare cases. Yeah, so we need to talk about the treatment. We need to talk about the treatment. The treatment of ovarian cyst are there, and number one, we have what we refer to as the watch for waiting. What we mean by watch for waiting, this is whereby after we confirm that you have ovarian cyst, we does not rush into treatment immediately. We give you some time first to wait, because remember we talked about the functional cyst or the simple cyst. This is the follicular and the corpus luteum cyst. These are the simple cysts that disappears within a period of some few months. They disappear. So in most cases, we don't have any reason to manage this. We just wait, and then after some time, we give you a TCA to come and have an ultrasound again to check whether these cysts are shrinking or they are continuing to grow. So watchful waiting is one type of a treatment. We also have another type of treatment where we can decide to give you the hormonal pills. The purpose of hormonal pills, although this one does not work so well, the purpose of these hormonal pills, remember, we said these functional cysts, the corpus luteum and the follicular cyst, they occur as a result of ovulation. So we try to give you these hormonal pills in order to cut off that process of ovulating. So if we cut off this process of ovulating, then it means this cyst will not keep on growing. So that one is also another kind of treatment that we give. Another kind of treatment that we give for ovarian cyst, automatically we have surgery. And this surgery we classify into two. We have laparoscopy. So we have laparoscopy and we have laparotomy. Okay, so in this laparoscopy and the laparotomy types of surgery, in laparoscopy, this is whereby the doctor makes just a small incision below your navel or below your umbilicus. So after now we make just a slight incision, then we are guided by use of it's called an illuminated camera to see where the cysts are laid. We can remove them if they are just small. If now these cysts are somehow bigger, that's when we perform just an open surgery. We open your abdomen and we try to remove these issues with the cyst. If it happens, maybe we have realized that these cysts are somehow cancerous, or they are malignant, they are at a risk of giving you cancer at the final days, then we perform a surgery that we refer to as hysterectomy. So hysterectomy, this is the complete removal of the uterus. So this is where we remove your ovaries, we remove the uterus, we remove the cervix, we remove everything, the fallopian tubes and everything. You are just left with your vagina intact, but any other organ inside there we remove it. In this case, we only remove it after we have done the CA125 test, or maybe we have done a biopsy from your cyst, and we have maybe discovered that these cysts are somehow malignant, they might cause cancer, so we decide to remove entire of your uterus. So if they are not cancerous, or in other words, if they are just benign tumors, we just remove them and we leave everything for you intact. Okay. So in most cases, this follicular cyst, the function of the follicular cyst and the corpus luteum cyst, in most cases they does not cause infertility. Okay, but if it happens you have this kind of endometrioma cyst, because they can result from PID, they can result from endometriosis or even the PCOS. If it happens you have that kind of a cyst as a result of maybe endometriosis or as a result of PCOS, they might lead to infertility. All right. So so that is all about these ovarian cysts. So generally ovarian cysts, these are conditions that can be treatable, and the most common type of cysts that I've so far seen, most of them are functional. These are either follicular or the corpus luteum cyst that in most cases goes away by their own, and then does not cause any alarm for infertility. But if it happens you have any other type of these cysts, you are most likely to suffer from infertility. So that's all about ovarian cyst, and that it's marking the end of our video today. And as usual, if this is the very first time that you are coming across this video, kindly consider subscribing, consider hitting the notification bell, and so that anytime I upload a new video, you will be the very first person to be notified about it. You can also comment. If you have any question, write it into the comment section, and I will be very, very willing to assist you. Kindly keep on subscribing, keep on sharing, keep on liking the videos, and keep on also sharing the link for me until we keep on reaching on very, very many other people.